So you tighten to the right proportion, but now there's room for retightening, because you'd rather come back and retighten than over tighten, and now you can't release it.
Now for a couple, instead of the lady coming for tightening, why can't the man come for addition?
Now it's best actually it's just the same thing. It's the same discussion as clipping the what's it called, the fallopian tube and vasectomy. Yeah.
Unajua unaweza pata wife ameenda tightening na mzee ameenda gas.
Actually it has happened like that. And
let's say you have a client anataka tummy tuck, anataka kuongezwa gluteal minimus, anataka they want multiple procedures. Will they be aligned? All these procedures can be done, like you can design the whole body at the same time.
Yes.
Alafu uende upone mara moja.
That's very important.
Wadau, show leo ni moto sana, lakini kabla tuzame kwa conversation, a quick word. Najua unajua Starlink, but do you know nani amekuwa akiinstollia wase Starlink across the country? The Sigmoid group. If you ever need internet installed for your apartment, your single family dwelling home, ushago, whichever part of this country, you need to check out the services, the Sigmoid group.
The internet has been so reliable, and then when you have an issue and you call someone from Sigmoid, they always answer and resolve the issues quickly.
The Sigmoid Group ni one of the leading ICT solutions companies in the 254. Ikwe ni solar installation, ikwe ni CCTV installation, uninterrupted power supply. Hiyo nimesikia ni system wanakuwekea yenye hautawahi notice stima ikipotea for hours on end.
You know, I can't stress how good this system has been and actually changed the camp's life. The amount of days we used to have no power, we could go 2 or 3 days with no power. That doesn't happen at all now. We're pretty much covered the whole way.
Please get in touch with the Sigmoid Group with the contact details tumekuwekea hapa kwa screen.
Hey wadau, our guest for this episode is our resident plastic surgeon, one of the finest in the country, and one member of the team that came together to put together Nairobi Sculpt, a surgery hospital, a cosmetic surgery hospital in the country. Now, depending on who you ask, ukiuliza wase wenye wamemuona on our show before, watasema what it will feel like, or someone who's never watched him on our show before, they would think I'm interviewing myself, but then again, yeye ni legend wa cosmetic beauty in Kenya and on a whole new level. All the stages of medicine, from daktari to specializing in plastic surgery, Mr. Good Vibes, Dr. Ken Aluora. Welcome to the show.
Thank you very much. Hey, when introduced serious, I am even honored.
Niaribu. Our guest for this episode ni fundi wa boobs.
Sawa.
You want me to tone it down? Je, unataka haga? Nishuke tena?
No, it's okay.
Asante sana for making time for us.
Yeah, it's a pleasure. Always a pleasure to be here.
Very nice. Very nice. We've tried to set this up for a bit, and especially I was like, we have to do another episode.
Yes.
After I saw some comments on Twitter where people were like, mazeni BBL, no. Kwanza the smell. But before the smell, that was my premise. I was like, we have to bring this on set, like for Good Vibes. But then again, I come across a video on Twitter. I've showed you the video of a very, some people would say, very well-shaped lady, okay?
Yeah.
And now there's a conversation up where, there's no way this is exercise. There's no way I'm not inspired because this is BBL.
Yes.
That paints an image. BBL makes people perfect. But there's different sides of BBL, right? So much to unpack from that submission. Okay. Yeah. Please break it down for us. Umeona huo msichana?
All right. One of the things that BBL or surgery achieves is being more specific. Because you see, yes, you would do squats, but it would not achieve the perfect round or the very well done butt, right? So that's one of the reasons most of the people would be like, I don't think exercise would work, or I am not sure that is exercise, because it almost looks perfect. How many people are exercising? So many people are exercising, but if it was able to achieve that round, it should have been replicated in all those people who are doing squats and all that, right? But at least the beauty of surgery, yes, also it can't be like exact, but it will almost be perfect. And the thing about squats that from the video you showed, squats, yes, will exercise and build the muscle. But now you see, in mostly our population or our environment, what we need is a really enhanced butt. So the thickness of the gluteus, the muscle that will be made bigger by squats, is probably this big, right? And you want this big of a butt. So you see, you can't achieve all that unless you put volume. And that's why BBL will work now if you want that really enhanced butt. Not saying exercise is not bad. It is, but I am not. It's good.
Yes, okay.
It's good, but I don't think it will achieve what most people have. Most people think over BBL.
Okay.
Like when I tell you, think of a lady who has done a BBL, and then ask you, bring a lady who has done squats. I don't think it will achieve the image you have in your head. So that's where the contention is. I know I'll get so much slack because I'm saying squats don't work, but it's, I mean, if you think about it literally and practically, when you're exercising, you're building muscle. You're not building the fat that is in the butt. Yeah. So BBL achieves this. It builds the fat.
Okay.
And I guess exercise now, that's where exercise now will enhance the results. Yeah.
Before we get into the science, just for that submission, we want to go into the detail and the science, but we'd like to do this intro again. Ladies and gentlemen, our guest for this episode with the much detail mepewa za TZ is a superhero. Batman. Batman, karibu. So now take us through the science. Take us through the science, yeah?
Yeah.
Why exercise will not give you the shape you want? Is it because of how you do the squats? Is it because when it comes to exercise, probably how your legs stand will not be aligned this time with the next time you do the squats? Like, what's the science? Take us through, like, the process with which someone may achieve the perfect shape using squats, and how it happens with BBL.
Yeah, so for squats and mostly exercise, the target is the muscle, right?
Okay.
Yes, which
Inakuwa
is
ngumu, like
it's like, think about the biceps. If you go to the gym, you continuously build your biceps, you build your biceps, you build your biceps, so you get the arm.
So if a lady goes the squats direction, she's building a weapon.
Muscle. She's building a muscle. She's building a muscle, right? Okay. So the muscle of the butt is called the gluteus. The glutes, as you know it, on this gym.
It's another version of toxic masculinity.
The glutes.
Okay.
Yeah. So the glutes, which is the three muscles of the butt, which is the gluteus maximus, medius, and minimus, the three muscles. If you do squats, that's what you're enhancing. So the three muscles of the butt. And that is what exercise enhances. Definitely, you know, exercise will reduce the fat, right? Yes. So it will be more of a well-toned butt, but not a big butt, which is what now BBL will achieve. BBL is now going to enhance the fat. Because if you look at the butt, what do you have? You have the skin covering the butt, right? Just below the skin is the fat layer, which is the bigger layer in most people who have big butts. It's the fat that is probably 70% of what you're seeing. And then now the muscles. Yes, now the muscles is the remaining size. So if you do squats, you will probably be, yes, enhancing the muscle, but nothing to the fat.
Okay.
Right? And that's where BBL comes in. Now it depends on what you want. Do you want a big butt? Do you want just a toned butt, just a small toned butt? So if it's a big butt, unfortunately, I don't think squats only will achieve that. And therefore, now at least if it's shaping, also we are in control at least of the shape most of the times, unless especially around the butt. And definitely if you examine, if now you come, we examine the butt, we'll tell you, yes, this can move this way, this can move that way. And if you look at the butt, it's like a sphere, right? Yeah. So if you inject the fat, you're trying to enhance the whole round shape that is the desirable shape. Yes. Now, of course, there are other outliers who the skin might be so tight, it might be difficult to like stretch it out. So that one you might need more than 1 or 2 sessions of BBL to stretch it out, to force it to, yes. But also there's now the aspect of implants, which is the second option. Putting implants just like the way you put implants in the breast, putting implants in the butt. So that one at least can force it out faster.
Okay. So, kidogo hapo nyuma, you've mentioned 3 muscles.
Yes. Gluteus maximus, minimus, and medius, yeah?
So, those are muscles.
Those are just
Si
muscles.
ati kusema, ule akona haga ndogo, you can professionally say gluteus minimus.
You have all the 3 muscles.
Oh, everyone has.
Everyone has all the 3 muscles, yes.
No gluteus ability.
No.
Balance.
No, gluteus average.
So now, when it comes to, when someone comes, first of all these are factors.
Yes.
Either someone needs an implant, either someone needs the fat need to be reduced kidogo.
So, okay, when you come in, now we examine the butt, right? Number 1, go to enhance the butt, unlike the breast, is fat. So, fat is the number 1. So now if you don't have enough fat, because there are patients or people who are skinny, yeah, very lean, very little fat to transfer to get the very enhanced butt. So for that, for such patients, now implants would be the next option.
Patients or clients? You know, this vocabulary is very important in this context because the butt was functional. This is just tuning. This is Subaru things. Like in my world as a layman.
Yes.
This is just Subaru vibes.
Yeah.
Okay. Iko sawa.
Now you see, this is where now well-being means if you're not feeling like you're well enough, it means you're a patient. So she or he does not feel like the butt is her desired look or shape, making you a patient.
Did you just say he can?
Yes. Nowadays we...
Did you just say he? Like, ihaga ilipigwa injection na Dr. Ken. Like, do you know how inappropriate that sounds? Ati when Dr. Ken ali-inject.
Yeah, so we can do... Also, for men, interestingly, is we are reducing the butt. That's the more common one.
Reducing?
Yes. Reducing the butt. But nowadays, yes, you know, we are now in a different era. So depending on, for example, for transgender.
Okay.
Yeah.
Twende pole pole.
Yes.
When you say
Yes.
you are reducing, let me be very careful with the vocabulary.
Yeah.
I sense, let me not use the word I smell. I sense a vibe, a butt donation.
But
Like if someone wants yake reduciwe, can they donate their butt to someone who needs it?
Who needs it, okay. And that's a question I get asked, by the way, a lot. It's a serious question. Many people would want, some patients come in and they have a friend who has a bigger butt. So they're like, can she give me hers? So yes, unfortunately, no, we are not in that era, but because this fat is a cell, right? Fat is a cell. And so donating it means all those immune cells. It's like, let me put it closer home, like a kidney. You have to do all the screening and then check compatibility. So we're not there yet. Where we are, and I've seen some do rounds in social media, we have now, it's being tried. There's a company that's now killing all the immune parts of the cells, and then now you can donate that fat to someone else. It's called Aluora. Yeah.
Hey.
Yeah. So we are getting there, but we have to now remove all the things that might cause the fat to be rejected by the other person we are donating to.
Okay.
Just like a kidney can get rejected. Okay. Yes.
Okay.
So they're drying it up and removing all the immune issues. Then now we can donate.
Okay.
Yeah.
So now when you go back to men,
yes,
you say also men also need these services.
They need these services? Yeah.
The reduction or addition for transgender cases?
Some men we add, like transgender cases, and then some we reduce. So like, for example, if you're changing, I know this is a hot topic, of course, in the world currently. The transgender part. They're now transforming a male to female butt. Yes. So you'll enhance it, of course, now to look more feminine. Yeah. Now for the men, you've seen some men who have more like deposit of fat in the butt than they would love. Yeah, so those ones would come for reduction. But the additions, yes, for more feminization, if I would call it. But also, yes, some men would come and, I've not gotten such cases, but I'm just thinking, yeah, there's some men who might come and they've really lost maybe a lot of weight, or they have had issues like they have a lot of scarring in the butt or had a trauma. You see, it almost now comes back to enhancing the butt with fat.
Okay.
Yeah.
Okay.
Yeah.
Okay.
But it's an interesting time to be alive,
Okay.
that we can shape the butt the way we want.
Okay.
Yeah.
Wadau wenye tunaenda kanisa, mnasikia tutapewa mwili mpya mbinguni. It's an interesting time to be alive. So in this era of designer bodies,
Yes.
Ebu take us through the scope before turudi kwa BBL and the side effects that people talk about.
Yes.
Ebu take us through the scope of work of a plastic surgeon as far as cosmetic surgery is concerned.
Perfect. Interestingly, one of the things that always makes me love plastic surgery is that it's head to toe, from hair transplant, coming down to facelift, eyebrow, Botox, brow lift. So, and then you've seen some people with eyelids like drooping. So that's called blepharoplasty, to just open up your eye, can be upper or lower. And then you'll get your facelift, neck lift, and then now getting to the chest, men or female.
Neck lift ni sasa
You get it like.
unatembea hivi.
But if you look at
Well, neck lift, like neck
Your
lift is giraffe vibes. Like, as in, I'm just curious. I want to understand. Sitaki tupite mahali kama sijaelewa. Like neck lift ni kuinua shingo, wacha kutembea kama mwanadamu.
No. Now you see, for example, old people, with gravity, our skin sags. So you'll get them, and if you look at most, you'll get some people, and they tie the tie, you'll get something that's sagging, like skin that's sagging.
Like
So
ostrich vibes. Mostly kama ni bata mzinga.
Yes.
So what you're saying is,
so
like your neck lift is
Yeah.
not so that you can walk with your head high.
No, it's
So you
literally
can
just
you can never feel
the neck
shame.
is.
Okay.
Yeah.
So,
So the neck is sagging, so you're lifting it up.
Yes.
All right? Yeah. Then coming to the chest.
The neck is sagging.
Yes, this is part of the neck, right? The skin in the neck is sagging, and also there's the muscles called the platysma. You'll see like some people have bands over there. Yeah. So also just tightening it and making it look the way you're looking right
Where
now.
are you
Like for
taking
you.
it? Huku, chini ya jaws.
You'll see the incisions up here. So you're pulling it up. Yes.
Usiye
Just like a
tumeingiza huku,
facelift.
ndio
No,
mtu
we are
akuwe
not
anakula nyama kila siku.
kula nyama yako. Kula nyama yako kila siku. But yeah, there's that.
You just you unavuruta and then you take it
you
in.
pull it from the back. So you make incisions here and remove the excess skin. So you're literally like that. You see, if I do that, it's pushing it up, and now it looks youthful and rejuvenated. Then you come to the chest.
You can just wear a pull neck. Like what the hell? Unaweza toka nayo kama design.
Don't worry, we will be here when we are 60.
Bro.
Then when you tie your tie, you will see this coming down, which some people find it pretty annoying. So they want it up, right? Look at your probably grandfather or the elderly people, yeah?
Yes.
Okay. Yeah. So coming
to talk
back,
ahead, but for neck, there are people who have problems na rings.
Yes. There are those with rings. I've gotten such patients.
Yes.
So yeah, you remove it. It's almost, I'd call it like a scalp plasty.
Okay.
Yeah. So you remove them and stitch so that it's a smooth.
It's possible.
Yes. Because that's more of excess skin, like on the back of it.
You remove all of it, alafu.
Sometimes it can be worse. You'll see some people with bumps on the head.
You can remove all that.
Yes. That's the beauty. Because you see the skull is pretty mobile.
But what if you pull it and then the face goes up? Like
Now that's
ukivuruta, macho zikuja up, like what the hell, bana?
Thank God. Like God was good when he was making the face. But you like if you pull this, unless you release it from here so that you can pull that up, like the brow. But back here, there are zones of adhesions where the skull is held. So you can't just pull and then it pulls also your mouth up.
Hapa ilikuwa mapua. Okay. Haya, tumefika kwa neck. Adam Zeppel, mnaweza ngoa?
It's
that
done.
That is ENT surgeons.
ENT would do it. But also I'm seeing plastic surgeons doing it because that's also part of the transgender big in Thailand. Also, I think where Malaysia, I think, but it's really big in Thailand where transgender surgery is probably really ahead.
Okay.
Coming down
chest.
to the chest, men and female, the breast. So for men, man boobs, as you know it. Yeah. We call it gynecomastia. That's very common.
For men, the man boobs is just fat.
It's fat and gland. Both have glands. Yeah.
Like
so it
it's
depends.
boobs.
Yep. Because both of us have glands. It's just that the hormones are different. So they developed different. For the men, it didn't develop, so it's flat.
What are you saying?
Yes.
Like if men developed enough, wanaweza nyonyesha mtoto. That's
yes. That's now called gynecomastia. So the hormones have, and it happens usually in puberty, where now the hormones have stimulated the growth of the gland, right? And in some, also in some diseases like tumor of the pituitary gland. So the tumor produces hormones that will stimulate the gland to be big. So in men, yes. So the gland literally develops. So you'll get like 10-year-olds, 15-year-olds, or even older people who have that. But also there's the part where now they growing fat, associated with obesity. Yeah, so you'll see also patients who have gained weight now also get fat deposited there. So for those ones, it's mainly fat. But if you get patients in puberty or around adolescence, those ones probably is the gland is also there, which is affected, right? Yes. And then for females, it will be either now the breast is small, which is now we have to enhance it, put implants, which is the commonest thing, or do fat grafting, transfer now like the BBL, now put fat in the breast, which now we might need to do more than one session to achieve the size that you want. Then there's the opposite, which now the breasts are too big, which now is debilitating. You have the weight symptoms, it's difficult to find also your bras, and you can't, your quality of life is really made worsened. Because, you know, like some patients have had, they can't pick stuff from the ground, they can't mop the house or do house chores really, or they can't bend to tie the shoes. So that's the gigantomastia part, which now we also do to reduce the breasts. So for females, it's either or. For males, also, there is the other part of enhancing the pec to get a buffed chest.
The what?
The pec.
You called it a pec.
The pec major muscle.
Oh, yes. Iite na jina yake in full so that we don't mix up issues.
Yeah. So the pec major. So, you know, the way some men, when you go to the gym and you want now to look buffed, yeah, so that we can put implants to make you look that way. So that's one of the options.
You can do surgery to look like you've gone to the gym.
Yes, exactly.
No, please. Like you can.
Yeah, that is that is something that's very common. In fact, yeah, like when I was in Argentina visiting for that, we had a workshop on just the pec implants, and we had actually a 50-year-old guy who's done gym, and there's nothing, but now wants to enhance that. So we did the implant for
He's been gymming for 50 years with nothing to show for it.
For 15 years with nothing.
Or 15?
Oh, no, more than 15, I guess. Since
Yes.
his 20s.
Yes,
since
yes,
his, yeah, since nothing. Yeah.
Okay.
Yes,
And
but also there are those who just want to.
So if you do that surgery
Yes.
to enhance your chest, and then you now go back to the gym and start pumping, how
The
safe
results
are
will,
you?
you're okay. Because at least it's been studied and the implants are pretty safe. So you're very safe. You won't probably bust it or push it down or wherever. It's really in the right pocket. Yeah. So you're good. And actually, after about 8 weeks, you can go to the gym and lift.
So the problem with this conversation is I'm back doing exercises.
Yeah.
Na kifua yangu hata ikiwa legit, people will think because you're my friend, I cheated. But now, hapa kwa
I will tell you guys.
no, but Mungu anisaidie. There's no way ati nimekaa Nairobi Sculpt ati niongeze mafuta kwa kifua. Like, oh dear Lord.
Actually now, then there's the implants and also there's now the butt, the fat grafting. Not the butt, sorry. Fat grafting now to the muscle. Yeah, it's dicey topic because of course there's the issue of fat grafting into the muscle of the butt. That is a no-go zone.
Fat grafting is
Transferring
of
of the fat. Yeah, doing liposuction, taking the fat and moving it now there. Yeah. Now for the chest, yes, some there's now an atlas and some studies have been done on which muscles are safe, because that was one of the issues why BBL was banned. Injecting under the muscle and into the muscle, where now the fat gets into the blood, in the veins, and then out moves up to the heart and the chest and the lungs, and now causes death.
Okay.
Yeah, but now, yeah, but now at least there's there's some studies that have been done, and there's a surgeon down in Colombia who has also, and I think from France, in Dubai currently, and they have now classified the muscles just for safety.
Okay.
Yeah, to try and increase injecting fat into the area to try and buff it
That's
up.
what was causing deaths.
Yes.
Injecting of the fat.
Fat under the muscle and into the muscle, because the gluteus is the biggest muscle in the body, right?
Yes, yes, yes.
That means it will have the largest vessels, the veins, because each muscle has its blood supply, so the veins. So they did postmortems in Miami for the patients who had died, and they found actually injecting the fat into under the muscle caused injury to the vein, and now people the fat was injected directly into the bloodstream, and it's like causing an embolism instantly.
Okay.
Yeah, so that was the reason. But now we know that, and that's why BBL is pretty safe right now. That was way back in 2018, I think, 2019. But it's gone through all the phases. Now we've even reached the era where it's ultra safe. Like that word has been coined because now you can even use the ultrasound to know where exactly you're injecting, making it ultra safe. But yeah, now it's safe, and we know if you're injecting above the muscle, yeah, you're pretty much safe. And for most of the patients that we have, it's, yes, in experienced hands, it's easier to even just inject and know you're pretty safe. But again, it's very safe. Thank God for the era we are living in. The research has made us get here.
Has made strides.
Yes.
So now, I think when you mentioned
the chest, yes.
value copper chest, let's separate myth from fact.
Yes.
For men,
Yeah.
there is myth that goes around that when you look at the ladies, like the opposite genders, boobs long enough, you grow taller.
You can.
You grow taller. That's the meaning. But on the other hand, in terms of the reasons, the conditions that lead ladies to procure the services of plastic surgeons, kama hiyo ya like boobs that are uncomfortable, right? What causes this? Like we know tall guys, ni myth from our side, okay?
Yes.
But for now, the view.
The view.
Like what causes the conditions that boobs growing
bigger than.
Yes.
Oh, you think people looking at them grow bigger?
There are different narratives, but let me not float them to advance them. So you give us the facts. What makes them grow bigger?
Okay, so that's gigantomastia, the medical term. So that's when the breasts grow bigger than desired and now become very heavy, and the weight now impacts the quality of life. So you can even actually get people now, the breast is too heavy, it's compressing to the nerves going to the arms, it's causing back pain, neck pain. Some people have even had to undergo surgery of the back because of the back pain, but it's actually the breast weight. How that comes, majority of it, unfortunately, we still don't know what causes it, but some of the causes that we know are, one, the hormonal issues that can occur during puberty, adolescence as they grow. So that is induced by the hormones. Then there's also one that's induced by pregnancy, because pregnancy, as the body prepares for lactation, which is breastfeeding, the breasts will enlarge. And so in that, at that time, you might get now the breasts enlarging more than normal. And now they become heavier. And usually after pregnancy, you'd expect that they'd grow smaller, but they don't. So that if that happens, then now we know that's pregnancy induced, that they've grown that way. Some drugs have been shown, I can't, to also cause this, but that's also very rare. But and then also some have postulated about weight gain, right? Yeah, but and then there's also a factor of inheritance, genetics. So it's been inherited because in your family they've always had big breasts, and so it's hereditary from that. Yeah. So those are some of the causes.
Okay.
Yeah.
Okay.
Majority, unfortunately, we can't pinpoint what's caused. It could be, yeah.
Okay. So now, when you to go kwa chest.
For
ndio?
chest, yeah. So for breasts, and then tummy is the commonest thing also around in our environment, in our setting. So tummy tuck liposuction, so to reduce the fat around the belly. So that is cuts across men and women. They will both get either lipo or tummy tuck to reduce that, yeah? And then you can go to the back, and you'll see some patients with the back sagging. Yeah, so that one you can do a back lift to remove all that. And then now, also on the lower part, you can get the guys, I'm sure you've seen some patients or some people with love handles that have overgrown.
Love handles.
They
Is
call
it
it
the
love
ones
handles,
they
I don't
call
know why.
tires?
Yes.
Hizi za huku.
Yes. Those ones.
Za kushika mtu ukimwekelea kwa meza ya kitchen. Ama ukimwekelea ama juu ya gari for romantic. That's what they call love handles. I'm just guessing.
For romance, yes.
That's all right.
Yeah. Exactly. So you can do either lipo or tuck it. So tucking it can be up with a back lift or a tummy tuck, or you can do now an extended tummy tuck that will go towards the back to remove it. And then, yeah, you can do the tummy tuck. Scar can extend until the back.
Sorry, my mind is wild. So when you said naivuruta huku nyuma, I saw someone with a tail. Like, unaenda ikitomole huku nyuma. Thank you for clarifying.
Yeah. And then now, for the arms, of course, you can do implants. You can also get implants to enhance the biceps or inject fat. And also for now, for ladies, which is now more common in our setting, the ladies who have large arms. Sagging.
Yes.
Yeah. So that either lipo or now doing an arm
Nieke hapa.
called a brachioplasty. Yeah, so removing that. Either remove the fat, and then if it's sagging, you have to do an arm lift to remove the excess skin.
And if you have a client that needs these services, you have a way to hide the scars. Like
yes, now that's one of the challenges. I wish the person who, of course, will find a way to have these surgeries done without scars will probably be a billionaire or trillionaire, because we don't have
if you can,
what we do. Yeah, you'll probably see the scars, especially for the arms. So we try and hide them in areas where you probably are not so obvious. So for example, for the arm, it will be in the inner arm. So it will be obvious unless, it will not be so obvious, especially if someone has a long sleeved or is walking and you can't see the inner arm.
So unaipiga kama cutout.
Yeah. So we try and hide it in there, right? And then for the breast, it's under the breast, or sometimes you can use the armpit to access the breast.
What if the client is ticklish, bana? Unajua?
Yeah, it's a more difficult procedure, of course, but there are some surgeons who have gone and accessed the breast to put implants to the breast through the armpit, or just under, so no one usually actually sees it. And the scars are usually heal really well. For the tummy tuck, it's under the underwear, so no one can see it properly. So we are trying to put these scars in areas where
under the underwear.
Yeah.
Like the surgery is below the belt.
Yes. So it's like the CS scar.
But then, ukisema the scar is like safe, when it heals kabisa, you'll have the freedom to move. Like you can do heavy stuff
extremely
without
heavy.
the worry.
Actually, in 8 to 12 weeks, you should be able to even do sit-ups.
Without worrying?
Yes, that you will open up.
And now for the case like of a tumbo procedure, like
Yes.
like
Liposuction or
yes,
augmentation?
yes. If someone has like for the case of a man,
Yes.
I don't know kama this has been addressed. When you have the cubes.
Yes, high definition liposuction.
Yes.
Yes.
No. When you have them before surgery, it makes it very difficult for surgery to go on.
No.
To conduct a surgery.
It actually makes it easier. That's why exercise enhances it. The only thing that might make surgery difficult is now when you do these other procedures like cool sculpting or the non-surgical fat removal procedures because of just the scarring, but it will still
There is
be possible.
non-surgical fat removing procedures.
Yes.
What's that?
Trying, like for example, the ultrasonic, using ultrasound to try, or laser or radio frequency or freezing to kill the fat, and then the body removes it. But this is on very selected patients, and that's why some patients, like majority of the patients who come to the office, definitely it would be a waste of their money. But now someone like me, if the way I'm lean, that would work. But there is a point where this is not the best and might not even work. Because I've gotten patients, of course, who've complained, we've done this for like 2 years and nothing has happened. Of course, now, so that's where patient selection comes in.
Okay.
Yes. So that things like cool sculpting or what's this other technology? There's technologies out here to try and reduce the fat. Of course, everyone would want, and this is why I know many people fall prey to these technologies, because anyone would want a non-invasive option to remove. Like surgery is usually because it has to be done. And I understand that. But now for some, it can't work. Because the fat is just too much. Yes. So when you're going there, at least think to yourself, will it work?
Okay.
Yeah.
Okay.
Most of the patients in our environment who are seeking fat removal most likely won't work. It works mainly in people who are very lean, they've lost weight and exercising well. So it's mostly to just tighten a bit and reduce the very little fat that's there and stuff like that, yes.
Okay. So Kuna, now we've gotten to the sweet part of this conversation. Tumetoka kwa stomach.
Stomach.
I showed you an article shared by Butita's SBM Buzz where this billionaire had died in a, should we say, botched penis enlargement procedure.
Okay. Well, true. Now, unfortunately, yes, that can happen, but I don't know if it was botched or what happened. I tried researching.
Yes,
I've not gotten too much information about it.
Yes.
But there are many ways, and this is why safety is number one for any of these surgeries, especially also the guy was probably 60-something, 65, I think. Yeah.
Yes.
So of course, from there you're starting to think definitely you have to get your.
He has used it for over, let's give it, if it's 60 years, he has used it for probably over 50 years. No, 50, no, over 40 years.
Over 40 years. Okay.
But now he wants to enlarge it in the sunset years.
Oh, okay. Okay. I thought you meant he used the medication for over 40 years.
No, not the medication.
Okay. Okay.
The injection.
Oh,
You are explaining something about his age.
Yes.
There's something about age now when you want to lengthen.
Yeah, definitely. Of course, as you age, you definitely have to be more careful. And for any surgery, the extremes of age, those are delicate. Those are special patients, not delicate, but special patients. Because you have to make sure, because of anesthesia, right? So you definitely need to make sure their heart is functional, they don't have any medical conditions, because as we age, definitely there is a higher risk of getting medical conditions. And then I don't know what they were doing, but definitely also just checking if the procedure is safe for the patient.
You're using safe,
Yes.
not possible. Possibility is there.
Possibility, you can do anything as long as it's safe.
Thank you.
Yes.
So now, someone in my high school told me that they grew up among the Maasai culture,
Yes.
and they had a natural way to extend kupiga extension.
It's actually studied.
Yeah,
And that
extending.
is actually working.
Natural ways of extending. Kama for him, you
Yes.
can bust this for us.
Yes.
They used to tie at kamawe.
Weight. Exactly.
Kaweight,
That is
unahangiwa
actually
ukiwa
one of the
mdogo.
way. Yeah.
It pulls it for a better part of the day.
Yes.
Like you jam the transformer for a bit. Like it's
Yes.
like a routine.
Yes.
You-
Actually, one of the ways to lengthen is, and it's scientific, it's the expansion. It's just like the way the tummy expands during pregnancy because of the push, because of the baby, the size. So the weight pulling somehow will expand. Let me give you an example. The Maasai and the earlobe, they just keep expanding, and it will be long.
Wouldn't that cause erectile dysfunction because of the strain on the part over time?
Interestingly not, because the muscles adapt. The muscles in the penis will adapt, unless now it's not done well, and I don't think it will personally, because that's one of the ways we lengthen. So using weight, it's difficult to do, of course, and it requires a lot of, I don't know if it's patience or the patient really needs to be well motivated to do that, but it was working, and this has been studied because the communities that didn't used to put on underwear, interestingly, have longer penile sizes than communities that used to put on underwear.
Underwears do more harm than good to men. That's what you're saying.
Yes, yes. I know it will cause a hula baloo, but yes, because of gravity.
What in the chlorophyll
Gravity.
is going on up?
And the issue was gravity, right? Just the way gravity pulls down the breasts. That's how gravity will
We could
work.
use the same theory for short people. Like if gravity works like that, Nini, held you down. I'm Nicole.
No, it's interesting because it's been studied a bit, and that's one of the reasons, because gravity will somehow enhance, and that's why I'm sure urologists might help with this. They might say you would rather just leave the baby to hang around without the underwear than
or
with
carry the baby by
underwear.
the Nini to pull the weight, yeah? Reverse engineering. Reverse engineering. Body weight training.
That might
It
cause
grows
trauma.
It grows proportional to the baby's weight. Unamuinua nayo asubuhi akiamka nini?
That's not safe. Please do not do that.
No, see, it's
But
proportional
yes,
to the baby's weight.
yes. But that's one of the ways. Using weight to try and lengthen the penis. What he was doing was probably increasing the girth, which we also do with fat. So you can
Girth
girth
is
is the width, the width. How can I? The size, not the length. The length you can pull. The girth you can increase the volume. So increasing the volume, you can inject fat, and it will increase the girth.
That new round circumference.
Yes, the circumference. Or the
Kunywa
diameter.
Kunywa mafuta. Na inaamshwa na ile turbo ya kitambo. Like the power that used to inaamsha the small one. Ukiongeza na mafuta, it still carry the same weight. Unajua, I'm thinking Subaru vibes hapa. When you tune your engine, you must back it up with where the power is coming from. Ama unamwambia tumekuongezea lakini uongeze na matunda. Like is there like huwezi ongeza, huwezi eka like big wheels on seats, right? And expect it will not change the fuel consumption. Ama this way you get feedback like, hey, na siku hizi nakula sana. How do you fuel it? How do you fuel the new additions?
the body is a very interesting creation, because the beauty is, yes, you do not need now, it's all in the mind, of course, and the muscles will adapt, and you will, erection, is an issue of blood flow into the penis, right?
Sawa,
Yes.
but okay, I have so many questions.
I
When you
understand.
have a client easy, when do you know, like, hii imetosha sasa daktari? Like,
No.
this is enough. Hii itatosha kazi.
Okay,
Like, this is...
now I get where you're coming from.
Yes.
Okay, you can't just overfill with fat.
So it is your discretion. When utanichagulia, whether utumie hii sasa, ikiweza utaniambia. Who
There's
gives
now
feedback? The nini or the end user? Like, is it the person? Is this the patient? Or the patient will give you feedback from the vile watu wake wanasema. Daktari uliweza. Like, hii kwa kazi fiti sana. As in, how do you know the improvement? What's the metric of the success? Yani?
Yes, the beauty is it's very well subjective, and if the patient is happy, probably you've done a good job. And this is the part where it's all about how the patient feels, and the feedback comes now from the patient. But now, first, before I go there, how much we need to put. The issue of injecting fat. It's a cell, and it needs to get enough blood supply so that much of it stays alive. Mm-hmm. So we can't also overfill, because the fat that you've put, imagine this is where the blood supply is, yeah? Mm-hmm. It's coming like this, and then we've put fat, yeah? Like that. So what is the fat that is here is not getting the blood supply. Mm-hmm. So this will die. So you'd rather put just enough, and their quantities, probably you're not putting more than 80 mLs in the penis. And you will also see, because you don't also want to overfill, because you'll get now other complications. So you want to just put enough that will stay alive, and that will enhance the function. And the beauty is, again, the interesting thing about fat is when it stays alive, it can also grow.
What you're saying, this is like in the movies.
Yes.
Like when someone is in an emergency, alafu daktari, someone like the CIA want to interrogate the person, and they want to wake him up, na wataka kumdunga adrenaline. Daktari anasema, muongeze 3 ml. No, he can't survive. Ati, oh, niaje, normal human being, I can't add any more than that. Anaekewa bunduki, anaambiwa weka, anaweka. So I'm assuming it's a team of doctors working on one penis.
Yes.
So now, mnasema, let's say, tuweke 80 ml.
Yes.
Alafu uzuri wenu Nairobi Sculpt, you are a team gender balanced.
Yes.
So wewe you have your opinions as a man,
like
hiyo iko sawa, then daktari mwingine anasema, ukimuongezea, just add 12. Mama, trust my judgment. And while at it, is it so far all these procedures tumeongea, everyone at, let's say, let's use your team, for example, everyone can do every procedure. Ama kuna pro wa liposuction, kuna client anaweza kuja sema, tuko na client wa mtipatia Dr. Karim. Like, is there specialization? I'd like to know.
I understand. Yes. Of course, there are people, it's about interests also. Right? Some people are more interested in the face, some people are more interested in aging, science, some people are more interested in breast and body like I am, and some people are more interested in the whole, the whole thing.
Depends.
So it depends. Yes, there's specialization and interest.
Okay.
Yes.
Okay.
Yeah.
So
but now in that, the dosage, that's also a safety issue, because also if you put a lot, now you'll get things called oil cysts. Because of the things, because of the fat dying.
Now, if you put less kidogo,
you'd rather put less
when someone
and then
goes
come
and
add.
Oh, you can add.
Yes.
Okay. First of all, how much? I want to measure the opportunity cost of kuongeza mafuta versus not wearing an underwear. As nataka kujua the cost implications hapa. I'll not ask about hizi zingine. By the
By the
producer Wiki, kwa hizi vitu zote tunasema, Wiki ameweka namba ya how you can reach the team of surgeons, plastic surgeons on Nairobi Sculpt hapa, in case uko na swali ama una feel there's a question I've not asked ama unataka ku make an inquiry. But this, for me, nataka kujua ni how much. I want to measure the opportunity cost.
No, by the time you're old, I think
It's for old people.
No, I'm saying you should have started not wearing an underwear when you're younger, when you are growing.
At what age for the parents watching who want to invest in the future of their
Of course,
children?
there's no fixed age, but of course, the young people.
Diaper, toa, nini.
That will be too messy, but I guess, of course,
No,
during
ushago watu
puberty.
wanatembeanga free
Yes, and that's good. But
So there are benefits
you're putting
to
me in a
poverty.
fix because
There are benefits to poverty. You understand? As in happiness,
this
like
conversation has
the
taken
link to
different
happiness.
tangents.
Ask your money can't buy happiness, but could buy the fact. Lord,
Yeah,
that's what they meant.
but yes, when you're much older, yeah, I don't think the option of not wearing underwear is
will
there.
help. So
Yes.
pennies stop growing at what age? This you
That's
know.
good. And I wish I had the exact answer. I'm just off the top of my head, but I know you put me in a fix and I've forgotten the exact age.
Give us a
But a
range.
range,
Give us
of
a
course,
range.
after puberty, most of it, I probably think above 23, what you have is what you'll remain with. But please don't quote me.
No,
but
no,
it's
I'm
an
not
age.
quoting. I'm not quoting. I just want to put a fix.
Yeah, probably above because during puberty is when now everything is the sexual organs are now really growing and
So for men,
maturing.
past this age, isipozidi muone daktari. Sawa.
But yeah, it's just like also the man boobs because we usually we usually wait sometimes unless they're really big that for sure you need surgery. Like some patients, I've had a patient who's 9 years and the breasts were literally like a B cup.
Oh, so it has to be removed.
Yeah,
But there's also
now
a
there's
risk
also
of it could grow back.
no, interestingly, now when we remove even the gland, so that reduces the chance of it growing back.
Okay.
But now for some patients who it's just a small growth, we usually wait it out until maybe 16, 18, 19, probably till 23. That's why I've said like most likely after 25, you've
You're
really
that patient.
matured.
Like someone would come to you when they know you're too young for this. Let's give it time.
We would offer that, yeah. Yeah, and that would be the right one, the right way. Of course, if you also do the hormonal profile of the child, and then you will know. Yeah, for him, yes. But there are also some stages where it has really grown big.
Yes.
Even if you wait, there's nothing that you'll do. So it's a judgment call when you come for a consultation.
Okay.
Yeah, I'm like, okay, yeah, that's too small. Just wait it out, it will go down. That's too big, definitely you'll need surgery. So in consultation, we can tell.
That's where the balance is.
Yes.
Okay.
So also the penile growth, I would think the same. Urologists would be best placed to answer this.
But this is also a plastic surgery thing.
For increasing the girth, yes.
Oh, kunonesha.
Yes.
Like, but pulling, that's for urologists.
Yes, pulling and also, I would say yes. But pulling is mostly parental and I don't even think. And there are people who are born with what we call micro penis, meaning it's too small. That's a deformity, right? And that one now we also have to work with the urologist to see how to lengthen. And
But
then,
in one of our conversations,
Yeah.
in one of our conversations, you said that everyone, when you finger where imali imetokea,
Yeah.
right, like the length is measured from the outer part, but there's a kapati yenye
Inside.
remains inside.
Yes,
So
yes,
there
yes.
are people.
Now that's where if the people who have a small
Oh Lord, I have a wide mind. So there are people who,
Yes.
who the part that remains inside is bigger than the The part that is
No,
outside.
it's not like that. But there's an allowance that can help you lengthen.
Exactly.
Not that there's a part that remains inside because of not growing.
No, ndio nasema, see, there's a part that remains,
Yes,
which
there's
can
a
be
part
pulled out.
that can
equal
be
length.
yes,
Exactly.
yes.
So it means this is a possibility. I'm just thinking. You could find a client
Yes.
or a patient who the part that is inside is longer than the part that is outside, because that will
Yes.
be a redefinition of. Like, and then now,
Yeah.
if you pull the part out,
Yes.
what foundation do you put? za
Yes, that's some
kuishikilia
of the things that we actually.
so that you don't go hitting things huko nje irudi ndani yote.
Now that's the reconstructive bit, but I thought you would ask about now erection, because that's one of the challenges that we have when you release it. When you release it to lengthen, because that is part of the root.
The root.
Yes, that's the penile root, which you're trying to release it to lengthen it.
It's the part that holds down like
Yes.
this when it sends the other part on a mission.
Yes, so that now you might have a bit of weakness and that might have a challenge with erection.
So
That's some of the challenges. But now these are some of the things that we have to discuss with the patient when they come in, of course, especially for the micropenis.
you have done a procedure.
Yeah.
Unaona? Nikipeleka simu
Yes.
kwa fundi.
Yes.
When they wakinitengenezea screen, for example,
Yeah.
I see my friend Santovas, he comes back, tests the screen, aone kama inawaka before lock, alafu arudishe. So this procedure, the patient is under.
Yes.
You have pulled it, mumeweka reinforcement,
Exactly.
mumeongeza root, imeshika.
Yes.
Amuka. So now, when the patient wakes up,
Yeah.
instead of waiting for him to go home and give feedback, do you have a procedure to instantly know?
Unfortunately not. So we have to wait for him to now come back with feedback, unfortunately.
Juzi tulikuwa Nakuru, the team tulikuwa pia. This is another example to support that.
Exactly.
People were fixing a lorry.
Yes.
So kuna watu walikuwa chini ya lori, wanaambia mwenye ako ndani, finya, waachilia. There's no like.
No, that's unfortunate. That's
Zima tena.
yeah. So for surgery in around the genitalia, plastic surgery, unfortunately now, this is some of the things are like that. Like for example, vaginal tightening. Definitely you can't over tighten because that now will be worse. So you tighten to the right proportion, but now there's room for retightening, because you'd rather come back and retighten than over tighten, and now you can't release it.
Now for a couple, instead of the lady coming for tightening, why can't the man come for addition?
Now it's best actually it's just the same thing. It's the same discussion as clipping the what's it called, the fallopian tubes and vasectomy. Yeah.
Unajua unaweza pata wife ameenda tightening na mzee ameenda gath.
Actually it has happened like that, and
but yeah, not wild. My mind is not wild. I'm just thinking ahead.
Yeah, and it's just about the couple to discuss, and then they come. We've had a situation where a couple has come together and it worked out perfectly and they were extremely happy.
Kila mtu aliongeza kwake. Moja akaongeza, moja akapunguza
Yes.
They met halfway.
Yes. And so that can happen. Yeah, and I mean, it's all about the discussion between the couple.
Okay.
But all this is possible, of course.
Okay. Hey Ken, na hiyo expertise yako unaweza ongeza kitu kama circumcision, hiyo unafanya tu hata na nini, sio? Like you need easy peasy. Like if you want to. Like easy peasy. Now please break down as BBL. Tuende
Yes.
kwa BBL alafu
Yes, now we-
tukiendelea kufunga.
Uh-huh.
BBL, what is this complaint that BBL smells so bad that you wouldn't want to be in fact near someone who just went through BBL? So in fact I think it's Nicki Minaj ama huyu mwingine anaitwa nani?
Cardi B.
Cardi B, yes.
Yeah.
Cardi B alikuwa kwa event and then there's a video of her walking alafu kidogo akacancel hata hiyo event akuenda, watu wakasema BBL kimelipuka. What is this about? Please
Yes.
bust some myths and misconceptions around BBL.
Honestly, I have not experienced it, and I keep asking patients because they definitely ask. Because sometimes patients are actually in the waiting room, and I ask them, "Do you know you are seated next to someone who we've done a BBL on? Did you feel any smell?" And no one has actually come to tell me they've felt the smell.
Yes.
Like BBL has really boomed, and I'm still looking for that smell. So I honestly do not know, unless now we are talking about an infection, right? Because infections will have an odor. I can't really think how a BBL smell will come about if done, safely and correctly. I don't know what that is, honestly. If someone has a BBL smell, I would like to to really smell. And so trying to think about it, the only thing that comes to mind, maybe an infection. What else? Maybe, I don't even think even if fat dies, like inside, you would be able to smell it.
Fat is a living thing.
Yes, fat is a cell.
Okay.
Yeah, so if the fat dies, I don't even think you'll be able to smell it because the body usually just removes it on its own.
Okay.
Yeah, so the BBL smell, it has caused a buzz and everyone is talking about it, but I can't find someone who, and we've done probably, it's really gone up.
Okay.
Yeah, and all the patients, I wish I could call them to just start smelling them each. But I interact with them and we follow them up even up to, some have come a year after.
And they're good.
And they're good.
Okay.
So I think that's a myth.
Okay. And in terms of these procedures, when you talk recovery, can someone have multiple procedures at the same time? Let's say you have a client who anataka tummy tuck, anataka kuongezwa gluteal minimus, anataka they want multiple procedures.
Multiple procedures.
Will they be aligned? All these procedures can be done, like you can design the whole body at the same time.
Yes.
Alafu uende upone mara moja.
That's very important. And yes, you can have combination procedures, but again, the issue is safety. And some procedures can be combined, some can't be. And it could also be because of recovery. Because, for example, if you're doing a tummy tuck and BBL, the recovery will probably be tricky. Because if you do a tummy tuck, you really have to lie down facing up, right? If you do a BBL, you would want to lie on your tummy. Yeah, so that one you have to really have a candid discussion. What's your priorities? And so if you're just transferring just to enhance the butt a bit, that's okay. But if you're really going for the BBL as a priority, you can't combine it with the tummy tuck. Probably you can combine now breast implants and the tummy tuck. You can do an arm lift with breasts. I wouldn't do, as I keep saying in my socials, I wouldn't do arm and thigh, because that would be hectic recovery. So yeah, so they can be combined, has to be safe, for me, I usually love an easy recovery. So that recovery is good for you, because recovery can be challenging and you really want to be able to walk around, because that's one of the risks for any long surgery, which most of ours would be blood clots. So you want to be able to walk around. Yeah.
Okay. Of course, you know, I pictured a situation where
Yeah.
nikiingia Nairobi Sculpt,
Yes.
I find one of your team members anachini na kunywa chai. Hey, what's up? What's doing? Sema, nangoja Ken afunge hiyo haga ndio niende nianze matiti. Like a garage of some sort. But tumeclarify vizuri. Cause garage inakuanga hivyo. Inua gari alafu mtu akuja.
But that happens now in multidisciplinary, like for example, cancer. So you're getting like head and neck surgeons are doing this, then maxillofacial surgeons are coming in, then neurosurgeons are coming in, then plastic surgeons are coming in. So you'll get us chilling to be the last ones.
Okay.
Right? Yeah.
Okay. Okay. Tafungana something like comparative, because we had a doctor from is a neurosurgeon, neurologist, Dr. Harun alikuwa amefanya neuroscience. Amefanya neuroscience. I get mixed up between neurologist na neurosurgeon, but he's trained in Germany.
Okay.
Nilikuquote somewhere because of training, like in terms of like how much money you would make kama ungekuwa na work US. But then before we go to that, watu kumekuwa na accidents wakati watu wanapata nick work. For the sake of people watching this episode now, let's say wanaweza amua kwenda any other place other than Nairobi Sculpt, how would they check the qualifications or to in safety out the qualifications of the surgeons doing the procedure?
Yeah, I'm a very big advocate for safety. I even ask the patients, please check if I am certified. Yeah, and it's so easy. Just Google in the KMPDC, the Kenya Medical Council. Just even Google Kenya Medical Council registry. It has a registry for all registered plastic surgeons, and at least we since we know all of them, and currently I'm the Secretary General at least.
Najua Secretary General wa mafundi wa Kardashian.
At least I can attest that the registry will give you none who is a quack. The problem is, of course, as I saw one of the memes that I know a cheaper person.
Yes.
Yeah, but I mean, it's your right and it's your life, because I feel like everyone spends so much time looking for land and will do all the due diligence. A car, they will do all the due diligence. They will know which model, when was it. But now when it comes to just removing like things to do with your health, they'll go to the next available one.
Or voting.
or voting.
Yes.
Yeah. So I really I'm really saddened by like some of the things that happen, because it's so easy to check, especially in this era. Like literally you just go to KMTC, you'll see all the qualifications and they have to be there.
Okay.
If they're not there, then now you're thinking, who am I dealing with?
Very nice. Dr. Ken is always generous with information. Na vile tumesema kama hujaenda Nairobi Sculpt, umeshapatiwa procedure ya how to make sure you are safe if you decide to procure the services of a plastic surgeon. Now, when it comes to the motivation to do the gig, like you've traveled, mimi nashanganga sengine mtu akipiga naye story huko most of the time actually outside Kenya, but it's not working, it's mostly workshops. Because uliniambia it's very difficult to work outside your country. Sindio?
Yeah, definitely, because every country tries to protect its people, of course, because it has its they are obliged, the country, like our medical council is obliged to protect the Kenyan people. So some of the countries are usually very guarded about who's coming in. And especially the first world countries, definitely you can't just walk in and start practicing. So you have to go through their licensing. So you have to do a licensing exam. And then some, like for example, the United States, you actually need to go through their residency to be able to allowed to practice there as a specialist. So those are some of depending on how you look at it, I just see it as protecting your
Not
society.
qualifications.
Yeah.
Kim Kardashian unashona yote.
Yeah, of course we participate, we all know, but I guess it's just now the political aspect of it. Because, yeah, definitely, because I've given a talk in the US. I've worked rather with people from abroad, and I was in Argentina the most recent. And yeah, it's more about now the duty, and of course now this is more policy. But again,
Amefinya. I believe if my math is not wrong, because tumepiga story nini, our conversations mostly are going for medicine.
you even saw
unless
actually
camera
Kenya.
ikiwaka.
Yeah.
Your
So,
experience
which
is
is okay.
across 10 years now, so
Yeah, I'm now
professionally.
as a doctor, as a plastic surgeon, more than
Plastic
5
surgeon.
years.
Plastic.
Yeah.
Plastic
More than
surgeon
5 years.
more than 5 years. That's solid experience. But if you decide to go to the US to practice, unakuwa umetoka form 4 after.
Umetoka med school afresh. Because you see, you
Oh,
have to
they
do
will recognize your
undergraduate. Yeah, at least our undergraduate they recognize. The specialization is what now most people will not recognize.
But still, they will require you to go for training. 7 years.
Yeah, 7 years.
Okay.
So you have to go and back and do residence. It's all about policy. I think there are some states that are reducing those rules, but I also get them because honestly, yes. Like for example, in South Africa, you can't register. They would want their people first to get the jobs, just like what our cabinet secretary was saying about first give the jobs to Kenyans and then give the jobs to other people.
But we have people like Shoetu na what you are in different parts of the world.
Yes.
Unaweza enda upige kandarasi, like would you take a gig to go fix a bat in America from someone in Kenya? Like unaenda kutengeneza haga ya Mkenya.
No, now you see that's the intricacies of making that happen means you have to get a center. You have to have rights.
So you will be practicing. Haitakuwa
Yes.
house call. Wewe mwambia sikuja nikutengeneze hii haga Mexico. Unajua at least tuko wana recognize.
Exactly. At least in East Africa you can move freely.
But you haga tize.
Exactly. Just like the way in Europe you can move freely if you've done the IBOPRAS, which is the plastic surgery certification.
So had you studied in America?
Yeah. At least America, is a big economy and definitely they're very rigorous. They're way ahead of the game. So, of course, they're more...
So you coming back would be easier
than going there. You see it every day.
Okay. Asante sana.
Yes.
Asante sana for sharing the information. I hope kama kuna kitu yote nimesahau kuuliza Dr. Ken, this specific conversation tulimfinya kuja hapa. Wewe unakuanga kama huko kwa nini? I think your surgeries are too long. Design to as predict timetable yako na ukitoka inakuanga Maldives. So now thank you for making time for us. In case there's something we've missed in terms of body and story body contouring, in case there's something to miss, please to make a contact the Nairobi Sculpt, where Ken works with a team of some of the finest plastic surgeons in the country. You can reach out, unaweza uliza maswali and unaweza book consultation. So unaweza uliza consultation.
Of course.
Line iko open.
Line iko open.
Very nice. Unaweza make consultation. Now, body contouring is basically what we've discussed.
Yes.
Yote,
exactly.
Alafu kuna kwanga na black nini knot. Kakitu like mtu akona kakitu kamefura. Hapa. So now I saw someone doing at there's a way to get rid of it at na strings like utacheza nayo na kamba like you pluck it inang'oka. Is that possible? You are our growth
I think that's like too archaic. Like honestly, you can just come and we'll remove it. And that's old school. Yeah, that's very old school. Like you can actually either come, we'll burn it, or we'll cut it off.
Okay.
We are way ahead.
Okay.
Like it's like going. It's like what? what is the, oh yeah, there are boreholes and I can't even give, it's just old school.
Okay, so there are better procedures.
Yes.
Mazi. Asante sana for making time for us. One final thing you would like people to know as far as these procedures are concerned. In our very first conversation, very many years ago, I think almost 5 years ago, ilikuwa after COVID.
Before?
By the way, ilikuwa around your COVID
Yeah,
time.
around, yeah.
So the conversation was some of these issues are more psychological, and it was very impressive that sometimes you don't even go through the procedures, you advise someone.
Yes.
Unapatianga nafasi ya kugo kwa sababu kuna hata nose sijui resizing mtu anataka
Nose job. Oh yeah, I forgot nose job.
Kuna nose job.
Yeah. Rhinoplasty.
Rhinoplasty.
Yes.
Na ya mkono.
Brachioplasty.
Your hand. Okay. So you say some of these things are more psychological.
Of course, yes.
You would offer counseling kwanza, ama you would recommend counseling?
Definitely. Yes, because of the, but some things definitely when you come and like, for example, you come and tell me you really have a big tummy and you want a tummy tuck. You, talking worry. I'd be like, where is the tummy? So you see that we'll need, that's more psychological.
Yes.
Yeah. Okay. So definitely you have to, we always think that way.
Okay.
And we only do things that we can, I feel like we will do things that we can only achieve.
Okay.
And that's a safe surgeon. Okay. Someone who can, will operate within the bounds of safety and the things that are only possible and have been at least approved and researched.
Okay.
Yes.
Do you ever, unakuanga TikTok?
Yeah.
Unapatanga time ya kuingia TikTok. But do you, have you seen content creator anaitwa Kabuda? Anakulanga tu alafu ana dance like.
He has a big.
Yes. Unamuona? He's ameingia fitness sahi.
Yes.
We wish him all the best in the journey.
Yeah. So now that's after, definitely there'll be sagging skin, and that's where we come in. Because there's now weight loss part, now using the medical or surgical, like for example, bariatric surgery or the Ozempic, Manjaro and all that. And then now, afterwards, all that thing, all the skin is sagging, and now that's where we come in to tack, lift, and all that.
Tumesahawaje kusema Ozempic, bro? How can we forget Ozempic? Please. How safe is this thing? Niko sure you've done some research.
I've done some research,
and
it's pretty safe.
What is Ozempic?
It's semaglutide. It's initially a diabetic drug that also now has been approved for weight loss.
It's a diabetic drug that has been approved for weight loss. So is it tablets? Is it injections?
There's both. There's both tablets and there's injection. The most common is definitely injection, but there's also tablets. Yes. And
so what does it do? It dissolves you from inside.
The ways that has been shown to work, of course, it's rather the ways that it's working is one at the, it's called the satiety center, where the center in the brain that causes you to feel hungry, it reduces the food noise. Let me put it that way. So you'll not feel as hungry, or you'll not be, there'll not be a signal to tell you that you're hungry, you should eat, or cravings, right? Like
it
sugar
kills
cravings,
the appetite.
Kills the appetite and the cravings. Perfect. You just put it better. And then also reduces the emptying of food from the tummy, right? So if food is not moving out of the tummy, what happens? You still feel full for longer.
So it extends your digestive.
It extends the time you feel full, so that you don't feel hungry. You get? Yes. So those are some of the main ways that it helps reduce eating, because the main thing is to reduce the food intake and cravings, to reduce now the weight.
So kwa hii uchumi, the people who complain that it's expensive to raise children wanakula sana, unapiga tu Ozempic, sasa unapiga 1 meal a day because they stay full. As in, I'm
I'm
thinking
not
ahead.
sure that would be a good
I'm
way
thinking
to.
ahead.
Because Ozempic.
Watu wangu hata wakulangi sana. Ukipiga Ozempic yako polite. Budget yako ya food ina reduce. By 60%. But they are growing fine. Like no food goes to waste. Ukiwapiga mchele Sunday, watakutana na githeri on Thursday jioni. Na wako sawa. By the way, kama mpikangi Ozempic. 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 Thinking ahead.
You're thinking ahead, but no, we can't use that for. We can't use that for that, but yes. Yeah, so the people who are on Ozempic, you might find that they're not eating as much as they were eating before, so that's how it helps them lose weight.
Okay. Kuna bahati sana sitaenda kwa politics za medicine.
Yeah.
And some of the things that zilisema hapa na Dr. Harun, ningetaka kuziraise, but it's not fair to you alone. Yeah. So I'll definitely have, we can plan for a panel of doctors.
Oh, yeah.
To be fair, because alisema the amount of gatekeeping yenye iko kwa hii profession yenu si fair, that even doctors super qualified kama yeye na others coming to Kenya to put up camps wamepigwa blockades mbaya. I'll not put you on that spot, like a panel of doctors. In fact, Dr. Harun, we were to do another episode but anarudi. So tutamweka hapo alafu na doctors wenye wako ndio tukuwe na full right of reply.
Okay.
But otherwise, asante sana for making time for us.
Thank you, it's always a pleasure.
Nimekuwa serious leo. Nimekuwa serious kabisa. This is the most serious interview tumeifanya. Conversation. I told a friend that, leo niko na kibarua cause being professional, when we know, now I trust you when you say that a gynecologist and a professional, that way, outside, I have aced it. So it's possible. Mindset. Now, if you're interested in plastic surgery services, tumeshawa plug. Wiki wameweka namba ya simu hapa, Nairobi Sculpt, na pia umepewa procedure. If you are interested in procuring services from any other qualified professionals, tumewapatia njia ya kujua. Asanteni sana for keeping us company mpaka sahi, for watching mpaka hapa. See you on the next one. Thanks.